If you're like most folks Dr. Kris Wusterhausen works with, you're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the DrKris.Life podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris podcast. Welcome back, everybody, to Peptides and Age Management with Dr. Kris. I'm Steve Brown, your host, and we're going to have a great conversation about what's the difference between starving and fasting and why fasting can impact your health significantly. And just to let you know, so Dr. Kris, Dr. Kris, how are you?
I'm good. How are you today?
I'm excellent. I was looking forward to this conversation, and always it's weird how it used to be if you asked me to go without a meal or something, I think I'd be kind of mad at you or offended. But when you look at it the right way, it makes a lot of sense. And so I'm looking forward to it. But I do want to remind everybody that even though we're getting all this great information for Dr. Kris, that these conversations are intended as educational. And you should always consult your physician before changing your medical program. So, Dr. Kris, what in the world made you want to talk about a whole episode on fasting?
Well, so fasting is probably one of the most common topics I discuss with my patients. And I have to admit, I've been learning about fasting more and more over the last maybe 2 years. I really actually would never have told my patients to fast if you talked to me 2 years ago. I was just not well educated on the benefits of fasting. I was always taught that you must eat 3 hours a day while you're awake, 6 different little small meals a day. And that's what I really touted to my patients. And sometimes that can actually still be the case. And so fasting was actually something that my trainer actually first brought to me. And as I feel like in health, especially when you get in your late 40s, there's always kind of these step back moments that we have with our own health where we kind of fall off the track and don't exercise as much as we should and let our diet get away from us. It always seems to happen to me after a big vacation or something. And so I was really trying to get back after it. And I started working out with our new trainer. And he was like, you really should look into fasting. It was about that same time that I went to my first peptide training. And one of the nutritionists there came and talked about the benefits of fasting. And that's where I started kind of my journey with fasting. But recently, as you and I discussed, I read the book by Dave Osprey, Walk This Way, Fast This Way. I will always say walk this way, like the song, Fast This Way. And I think it's a really interesting book. As I've told you, everybody has their own takes on fasting. So it's, I don't know that we'll ever get 10 experts to agree on everything fasting, but I thought he had some really good points and some things I've already mixed in for myself. And so I just thought it would be a good topic. Plus, I told a handful of my patients that over the last couple of weeks, like, hey, in a couple of weeks, we'll talk about fasting and spend a lot of time doing that. So that's kind of where it came from.
A lot of people listen to this program or watch, and you were just saying that, since our episode last week, you're been really busy in your other department. So, I was having a conversation earlier today, and they kept saying you should trust your gut. You should trust your gut. And I was watching a video where Dave Asprey was talking, right? And so it's interesting that we have bacteria in our brain that is the same bacteria that's in our intestines. And there is really a connection between your gut and your brain. And it started to make sense why that's important. Talk to us a little bit about that.
So the gut is where we get 80% of our immunity. And so many of our guts are unhealthy. Why are our guts unhealthy? Well, they're unhealthy secondary to stress, eating habits, lack of sleep, mainly the foods that we eat. So many of us are eating the wrong foods, inflammatory foods. It goes back to the big box food makers and everything being so processed and hormone ridden. So anybody that you talk to in wellness, the first thing they're going to talk to you most likely is about just your diet and your food intake. And, literally most Americans' food is killing them. I mean, it really, really is, because we're just, like when patients talk to me about food, I say the first thing I tell them is you should eat on the external portions of the grocery store, fruits and vegetables, meat market, maybe some of the frozen food sections. Stay out of the aisles as much as you can, because there's really nothing good that you find on the aisles. It's all highly processed, highly sugar ridden foods. And, if you can find a way to stay away from some of these really highly inflammatory foods, it can really benefit your health overall. It's something I've really had to come figure out for myself. I really figured out as time has gone on over the last 6 months that I think I have a true gluten sensitivity. Something that I used to like cringe when people said I had gluten intolerance. It was like, oh my God, it was like fibromyalgia to a doctor. Like, oh, sure you do. But I do think the more I study it, I do believe more people are gluten intolerant than they believe. But we're cramming down our mouth all these really highly inflammatory, highly sugar foods. We're really stressed. These guys like right here, our cell phones are constantly with us. We're getting beat up by TVs and computers and laptops till we literally get in bed and close our eyes. And we're just underestimating the effect that all those things have on our brain and our gut. And our brain and our gut need to be in a synergistic effect to get the most function out of them. When your gut is dysfunctional, your immune system goes down. When your immune system goes down, we've discussed at length all the different ramifications of when your immune system is inhibited or depleted. And so that's just why I'm actually really excited, because in 2 weeks from today is when we go to our next peptide training, and it's actually the gut. So, we're all really excited the gut is something as a practitioner that I'm right now really starting to focus on more and more, what I can do for my patients. It's always kind of been the topic that I've kind of wanted to avoid, but it's just at the point now where we have to really dive into the gut and the gut health.
So let's start with just the term fasting. What's the difference between fasting and starving?
Yeah. So the biggest thing I like to tell patients, what is fasting? I always like to just break down the definition. Fasting means going without. And so you can have a fast of any type. As in this book and any expert on fasting will tell you, fasting can be doing without, whatever your favorite thing is. Maybe it's a TV show. Okay, I'm going to go on a not watching Fixer Upper marathon or something, and for the next 2 weeks I'm not going to do that, and that can be a form of fasting. And so we typically talk about intermittent fasting, and in this case we're talking about a fast from calories for the most part is what we mean by that. And so when we talk about these fasts, so intermittent means, intermittent. So occasionally, although we'll discuss a schedule that might be appropriate for most people. And then fasting means simply doing without. Now, starving just means you're not going to, a lot of patients come in and they tell me, I already fast. I kind of already fast. That's what I always hear. I kind of already fast. And I go, well, there's no kind of. You either are fasting or you're not. And what they mean by kind of already fasting is that they just eat very sporadically and very small amounts. And I always say that's called starvation. There is a very particular way, in my opinion, that you should do fasting. So many, especially ladies, will skip lunch, skip breakfast, but they'll eat just a tiny snack mid-morning, and then they'll eat a tiny little snack mid-afternoon, and then maybe a very, very small dinner, and they will think they're doing good, but they're actually putting themselves more in a form of starvation. we're going to discuss it much more. But the biggest thing about fasting is detoxing the body. You're not detoxing the body when you're starving your body. You're breaking down muscle for fuel. That's not what we want. As I always tell patients, simply losing weight is not the goal, because we had to make sure we're losing fat cells, not muscle. We always want to maintain muscle, preferably for most people, gain muscle. So that's kind of what I always like to tell is the difference between starvation and fasting.
So there are all the different types of fasting. You know, the title of the show is Peptides and Age Management. And there's all these studies that show that fasting is actually one of the wonderful forms of helping you live longer, of improving your skin tone, of improving your health, improving your clarity of your thinking. There's a lot there.
Yeah. So, I mean, it fits right into our age management part of this discussion. And fasting, I always tell my patients, hey, I didn't come up with this. This isn't something that I've decided is a good thing. There's so many studies to back this up. There's so many studies ongoing right now. Fasting is such an important part of wellness, in my opinion. It can basically be done by nearly all patients. Maybe the only real contraindication I can think of is an insulin-using type 1 diabetic, or a diabetic in general. And certainly if you're a diabetic, you should discuss this with your physician before instituting this. But even then, I think we can do it for a lot of these patients. And so, so the benefits are just exponential. People very quickly feel better from fasting as long as they can kind of start getting into a groove. And the biggest thing I get from patients is they don't believe they can fast. They simply have been convinced that when I wake up, I have to eat. If I don't eat, I will literally starve to death and fall over dead by lunchtime, which is a ridiculous thought. So the most common fast that I believe is the easiest to do is what we call a 16-8 fast. And that is the general, usually the term that is used for intermittent fasting, which is a 16-8 fast. And in simplicity, what it means is that I am going to feed, aka eat, for 8 hours a day. I am going to, for 16 continuous hours, I'm not going to eat. So, I mean, that's the real easy version of that to tell a patient. So really for most people, all it is, and I think this question's always funny. They go, does my sleep count? Yes, your sleep counts. So, yeah. I think the easiest, really what you have to convince your patients of is like, okay, all you got to do is skip breakfast. That's it. We're going to skip breakfast tomorrow. And okay, if you don't, so you skip breakfast and maybe, and I typically do 12 to 8, although I will tell you I've changed my schedule, which we'll get to a little bit later and why. But normally 12 to 8. That's when I break for lunch. So that just starts my 8 hours.
8 hours of eating.
8 hours of eating, calorie consumption. Let's just say 8 hours of calorie consumption.
And you're not eating the whole time.
No, absolutely not. And that's one of the benefits that I can discuss here in a second. So 8 p.m., I cut my nutrition off, and the only thing I allow myself to have for those next 16 hours is water, unsweet tea, and black coffee with possibly a couple things in it. And I will allow myself ketone esters as well. And so those are the 4 things that I allow myself. And Dave Osprey has a little bit of a different take that I can discuss here in a minute about what you can do in the coffee. Of course, he also sells those things. But that's it. No artificial sweeteners, no creamers in the coffee. That's it. And so, so these patients, I try to convince them, okay, if you eat breakfast at 7 o'clock in the morning, let's skip breakfast and let's just see how far we can go. If we only make it till 10 o'clock, that's fine. Eat. Fasting's not meant to be miserable. Fasting is meant to actually be a pleasurable experience. And I think you can attest to the fact that once you get used to it, it's actually makes you feel better, increases your mental acuity, your focus improves because brain function no doubt improves with it. Well, I guess let's say that. What are some of the benefits of considering intermittent fasting? So remember that the biggest reason people gain weight in America, actually worldwide, is insulin secretion.
Mm.
So as we eat, and unfortunately the American diet is high in carbs and sugar, then the counter effect to that is an insulin spike. If I eat a donut, my body gets all that sugar dumped into my bloodstream from that donut. I get a blood sugar rise or spike. I then get a insulin secretion to bring my blood sugar back down to normal. If it's all working correctly, I'm not insulin resistant or diabetic. That then causes a crashing of my blood sugar, which then actually then gives me the signal that my blood sugar is going too low, which actually causes my brain to go back over to that donut box and grab another donut, and we do it again. And that's why one of the biggest reasons I try to tell patients, you just got to stay away from the sugar, because it's a very much, I've heard sugar compared to heroin, and I think that's a really good analogy. Is your brain just constantly wants more sugar. The great news is when you get sugar out of your diet, it doesn't want it. We don't need sugar added to our diet. That's one of the biggest myths I hear. Like, I must eat sugar or my blood sugar is going to drop. No, it won't. Again, take the diabetics out of this scenario. No, it won't. That's your blood sugar rising and dropping secondary to the sugar that you're taking in. So when you fast, and then you always hear me say the American male grabs 2 cookies on the way to bed to eat right before they go to bed. And then guess what happens? Most of our growth hormone does most of its cleaning up and its metabolism work while we sleep, because it works with the circadian rhythm. And when that happens and you eat those 2 cookies, well, that sugar spike and insulin spike because of that basically makes the growth hormone inactive. It counteracts it. But if we're fasting, and we should really, and this is one thing I probably don't hammer enough with my patients, you should really cut your food off 3 hours before you go to bed. We really want to be on a fairly empty stomach when we go to bed. There's plenty of studies, and patients can do this on their own. They can monitor their sleep with sleep monitoring devices. I'm a big fan of the Oura Ring. There's also like Fitbits and Apple Watches and all kinds of things to monitor your sleep. But just try it, eat a big meal and go to bed and look at your sleep the next day. Yeah. Try cutting it off 3 hours before you get to bed and see what happens. So not only do we want to stop the eating 3 hours before we go to bed, because we sleep better, less pressure on our diaphragm, less chance of reflux, which keeps us up, but also because of the insulin levels. So now if we're giving our body 16 continuous hours with no calories, no sugar, guess what happens? Insulin is able to stay nice and low. Our body is able to detox and do the things that it needs to do. Our weight comes down because we're not getting that. We're getting all that effect of growth hormone, and the insulin is not counteracting it. And the biggest thing with fasting in general is the improvement in autophagy. And as you and I talk about all the time, autophagy is so important. It's the repair phase of our cells. So our cells can change out the bad, throw the bad alternator in the pile and put the new one on, and all those sorts of things. And so autophagy really goes up with fasting. So again, so like for a beginner faster, intermittent fasting is where you start, and it may be where you end. You may never have to go any further, and there's nothing wrong with that. I mean, I toy with other types of fasting and that we can discuss, but if I can just get a patient to commit to intermittent fasting, that's, they're going to see the benefits very rapidly within 1 to 2 weeks of the improvement in their brain function, improvement in their gut. Because we're just not cramming as much bad food into our mouth if we're not eating for 16 hours consistently. Energy levels go up, libido goes up, sexual performance goes up, and the list goes on and on. Autophagy is increased, which is just making the body more healthy. So they all just kind of go in this nice, beautiful circular path.
That's crazy. My dog, she has this, it's amazing. Right at 4 o'clock every day, she's like, it's time to eat. It's time to serve me dinner. And I'm just thought that's amazing, but it's called ghrelin. Is that right? It was where it signals that you're hungry.
Yeah.
And so when you first do an intermittent fasting, you go, oh my gosh, I'm hungry, but it goes away so fast because of that ghrelin changes.
Yeah, so ghrelin learns your schedule basically, and learns when to secrete. Just like that's what's happening to your dog. She knows at 4 o'clock it's feeding time, and that's actually a good point I think that we should discuss here. So the ghrelin secretion will be increased in the beginning when you haven't skipped meals before, and as so I tell my patients when that hunger hits to use ketone esters or ketone aid, because ketone bodies get changed into butyrate in the body. Same way what he recommends bulletproof coffee with grass-fed butter along with MCT oil. Okay, medium chain triglyceride oil, and the reason that he recommends putting the MCT oil and the ghee butter in there is because it causes the actual ketone bodies to be secreted in the body. The thing that we're doing with ketone esters is we're actually taking that up about 4 notches. And ketone esters, because of the energy that butyrate is able to do, or ketone bodies, they're immediate fuel for our cells. And that ghrelin calms down, our satiety kicks in, and we don't feel hungry anymore. And then as you get into fasting, though, and as you get more comfortable with fasting, that hunger goes away. And ghrelin secretion is calmed down, and everything becomes okay, and you're able to then go without eating longer. And the one thing, though, that I am learning with fasting is I think it is a good idea to change the schedule up at times. And that's, I told you I changed my own schedule. I'd been on 12 to 8 for quite a while. I've actually changed it to 12 to 6 for a few weeks. So I'm now doing, I guess you would call it an 18-6 instead of a 16-8. And the only reason I'm really doing that is just to change my schedule up a bit, shock the system a little bit. And so, and like last Friday, Maury, I, and my wife actually did a 24-hour fast. And so, and I think there's real benefits to just really altering some. So he calls it like phase 1, I think stage 1, stage 2 fasting. And, as you kind of graduate from one to another, you may want to try other forms of fasting. And so kind of when you go from intermittent fasting, then the next one is OMAD, or 1 meal a day, or 24-hour fasting. Or really it's 24 hours, and then you get 1 hour feeding window before you go back into whatever fast you're wanting to do. And the advantage of that is just heightening the autophagy. Obviously, it's a little bit harder to do a 24-hour fast than it is an 16-hour fast, but it's not that hard. And so what I'm trying to really convince my patients now is, hey, once every 2 to 4 weeks, let's do a 24-hour fast. Let's mix that in. Let's shock the body a little bit. Let's make the body use fat cells for fuel. Let's make it use those fatty acids for fuel. The body naturally wants to use plain old glucose for fuel. And again, the issue is that most Americans take in too much glucose, and the brain and the body likes that. It's got all this glucose just floating around because we've ate donuts for breakfast and French fries for lunch, and you get the point. And it's able to use these. And so over the years, we're slowly packing on more fat because we have an excess of calories. And your body, even when people go back to working out, they notice that they can't seem to get those fat cells to go away. And that's because sometimes you got to use some of these biohacks to get your body back into the process, back into the phase of actually using its fat for fuel. And fasting is a great, great way. It's actually, in my opinion, the best way to get the body kind of tricked back into using that fat for fuel through fatty acids.
Our body is well designed to really thrive in a feast or famine type situation. And that's what you're talking about, breaking up these static rhythms where we always eat at the same time, and it's just not the best thing for our bodies. What was interesting to me, so if we're always producing insulin and our cells kind of get satiated with enough insulin, then it starts depositing it and it becomes fat.
Right. Yeah.
But what was interesting is when you're fasting, after your body does a little bit of a cleanup process, then it starts using the fat for energy.
Right.
And
through fatty acids.
Are ketone esters similar to what your body is making when it's using fat for energy?
Yes. And so it's kind of in my opinion, I've already had a hard time explaining this, but maybe we can get through it and it's understandable. So I will disagree with some of the experts out there. I don't think being in a ketotic state all the time is a good idea. In my opinion, and studies show that when you're in ketosis, and what is ketosis? Ketosis is basically where you do not intake carbs into your diet, less than 5% carbs per meal. So fairly carb free. I recommend to my patients low carbohydrate diets. I do think that we need to lower the amount of carbs that we take, but I think we need some carbs. When you're completely carb free, your immunity eventually goes down, brain function goes down, and increase in gallstones and kidney stones. So those are some of the ramifications of an extended ketogenic diet. Now, I think ketogenic diet in short bursts can be good. Like if we need to get a jump start on weight loss, I think for up to a month, it can be a very good thing. And then we can move over to a lower carbohydrate diet. So my patients, I kind of want them to pop in and out of ketosis. And that's what we're using the ketone esters, during the fast. We can, first thing in the morning, take our ketone esters, and that's going to put us at the male dose of 10 cc's as a female dose of 5 cc's. That puts us in about a 1 millimole of ketosis, which is a fairly significant ketosis state. Most people kind of range in 0.5 to 0.8 of ketosis per millimole. So we're putting you in a 1 millimole state of ketosis, and that's going to last 3 or 4 hours. And then ketone esters themselves are not causing you to burn fat, but it puts you into a ketotic state for a short period of time, which then a roundabout way starts using your own fatty acids for fuel, which does cause fat cell reduction. I kind of had this discussion a while back with the owner of Ketone, and I finally kind of understood it. Ketone esters themselves don't directly cause fat metabolism, but kind of indirectly do. And so that's what you want. You want your body to use these fat for fuel, especially for short burst of time. Then when you mix that with like proper exercise, HIIT exercise, or some people know it as like Tabata, 20 seconds on, 10 seconds off for 4 minutes at a clip of really high intensity exercise. I think Dave Osprey says, pretend a tiger is about to claw you to death. That's how fast you run for 20 seconds. And then you walk slowly for 10 seconds and then again for 20 seconds. Like here at the office, when we do those type workouts, we'll do like a little 4 sets of like, one's a bike and one's pull-ups and one is maybe sit-ups. And we'll do a little station and it's 20 on, 10 off, and then we'll rotate. But I mean, for 20 seconds, you need to give it everything you have. Again, because when we combine that HIIT into this program as well, it only intensifies the using fat for fuel. It also puts those stem cells into a quiescent state so that when you do lift weights and do your exercise, those stem cells are able to come in and really keep your joints and your ligaments and your tendons healthy and make everything feel good versus, us old guys and everything hurting after we get done working out.
You're watching Peptides and Age Management with Dr. Kris, and today we're talking about fasting. Dr. Kris recently read the book Fast This Way by Dave Asprey, and it's interesting how fasting done the right way can really extend your life, can make you feel better, and have clarity. I do that fasting, so I'll try to cut off eating at 7 and then maybe break the fast at noon. But I do the ketone esters in the morning. Of course, I have coffee, black coffee, but I'll mix 2 little capfuls in some water and take that on an empty stomach. And it's amazing the clarity that I get. I feel more awake. I feel more in the zone. And I just am really glad I started taking those. As you get older, maybe you kind of struggle to remember the words, or you feel a little bit in the fog and you wonder, am I getting, am I something wrong with my brain? But this fasting, again, I'm going to go back to the gut and the brain thing. It's huge. There really is this direct connection to what's going on in your gut and what's going on with your thinking. I'm even less grumpy. We make jokes about grumpy old men, as they get older. And I think it has something to do with this.
Well, and he talked at length about how fasting actually can put you in such a great mental state. And that's why some people may even want to consider extended fasts. Like today we have a product, and we have it here at the office. Many clinicians have it. It's called a fasting mimicking diet, and it's called Prolone. And basically, it's a 5-day fast where you are allowed to have foods that they have pre-prepped for you, because you actually, in theory, it depends. Some people believe the only way you can truly fast is to have water only. I don't believe that. Most specialists or experts in this field don't believe that. And then Prolone's even gone further to actually allow food during your fast, but it's very low calorie type food that has been shown not to break the fast. So why would a person consider an extended fast? Maybe they don't even do food. There's people out there that will go 4, 5, 6, 7 days with only water or coffee or ketone esters, things like that, to get them through it. Because first of all, the detoxification that you would get from a 3 to 5 day fast is just tremendous, but also the mental aspect. People that I've talked to that do these fasts routinely mentally just feel like it takes them back to a good place and keeps them there for weeks on end. You're able to get all the inflammatory junk out of the body. It helps regulate the neurotransmitters in the brain. Some people will say they recommend it for depression and anxiety. There's, again, it's just kind of one of those things that you have to get into fasting, start with intermittent fasting, see how it affects your life, and then determine if you want to take it further from there.
So it's like, okay, so I'm having empty stomach, but I need to go work out. Should I eat an energy bar, or is it okay to continue fasting? Is it going to impact my workout?
Right. And so that was one of the biggest misperceptions I have to work with working out. So the best is if you could time your workout to where it's at the end of your fasting regimen. So if you're on a 12 to 8 feeding and an 8 to 12 not eating, if you could time your workout 11 o'clock, finish it up at noon, and then you can go eat a meal, there'd be nothing wrong with that. Certainly if you're wanting to gain muscle, that's a good program to do. But you don't have to do that. Like I work out every morning at about 6:30. I don't eat until 12. It took me about a week or two to get used to it, because I was always the guy that did a protein shake or a meal before my workout, and after my workout, either a protein shake or a meal, whichever one I didn't do beforehand. And I was convinced that was the only way that I could gain muscle. That was the only way I could lose fat, which is just simply not true. You can actually do those things. Now, there's sometimes I don't recommend that for patients, not all that often. That's where getting with a good provider to actually map out, a regimen is so important. But the timing of your workout is important, depending on what your goals are.
So let's talk about sleep. One of the things from life extension, your mitochondria, your cell health, sleep is so important in there. And this fasting process really improves your sleeping.
Yeah. So unfortunately, as we age, most of our sleep goes down as we age. Our quality of sleep is what I should say. And we start to get less deep and or REM sleep. And deep sleep is usually that really reparative sleep. And it's usually in the first half of our night of sleep. And then REM is typically in the second half of our deep sleep. And that's just the one that makes us feel better and gives us energy. And when we wake up in the morning, that's where we dream and REM sleep. And they're both very, very important. But deep sleep in particular seems to really go down with age for some. And I'm one of those people, and I've been working on this for a few years. So the first thing is making sure that we already talked about it. Let's make sure our stomach is empty before we go to bed. Let's cut off eating 3 hours before we go to bed. That is a big aspect of sleeping well. As the point was made in the book, like you're on a business trip now and you normally eat at 6 p.m., but because it's a business trip, you ate at 9 p.m. and you get to your hotel room and climb right in bed and go to bed. You actually probably would have been better off to stay up till midnight, get less sleep, but actually get the quality sleep, because we confuse quality sleep for just how much we slept.
Mm.
So one of the big things I tell all of my patients, if they can afford to, as we talked about earlier, is to get some form of sleep monitoring device. I'm obsessed with mine. Again, I love the Oura Ring. I wish I had stock in the company. I don't, but they're fairly affordable, but you can get some really good data. How long you slept, what stages of sleep you got, how many times you awoke, your body temperature while you slept, your pulse while you slept. And you can start to figure out some things with time, like, okay, I did this and this was the result. I had a few drinks, I ate a steak, and I went to bed, and this was the outcome after it. The next night, I did none of those things. That was the outcome. And you'll start to realize some of the things that are causing your problems. But as we've talked about before, the other big thing with getting proper sleep is just overall good sleep hygiene. And so many of us don't have good sleep hygiene. You want a dark, cold room. The temperature they seem to think is best is around 66 degrees. And you want a completely dark room. And you really want to the best of your ability. I was talking about this with a rep this earlier today, is you really want to cut off all the lights as much as you can, at least dim them 2 hours before bed. You need that brain to start calming down. Cell phones, TVs, laptop computers, the LED light bulbs in our rooms, all those things. If we can, we need to try to shut all that stuff off, at least where, some sort of a blue blocking lens glasses to cut that down. But you'd be better off if your bedtime's 10:30, at 8:30, shut everything down. Just maybe lay in bed, read a book, do whatever. Just try not to use those screens. And that's a really big way to get that good sleep. Then if you use your sleep monitoring, you can start to get that sleep improved. And, sometimes we use sleep aids like melatonin, or we have a product called Deep Sleep that works really well. I also am a big fan of PEMF, pulse electrical magnetic fields, which are basically magnets under your bed that can help a lot block out all the bad EMF fields. There's a lot of different things you can do for sleep, but I believe so much of our health goes back to either the quality of our sleep or the lack of quality of our sleep.
I've taken that Deep Sleep supplement, and it works really well.
Mm-hmm.
You don't realize maybe how you're not sleeping well until you do sleep really good. Most of the time we're kind of oblivious to what's going on, but when you start to pay attention, like when you stopped eating and get past I can't go to sleep if I'm hungry. All these lies we tell ourselves, right? But we start to wow, I woke up, I slept like 5 hours straight, and I'm just amazed at how long we go on in a state of unhealth, and we just get used to it until we change it.
Yeah, I think actually most of us get very confused by this is just the way it is. And they think that because they're getting older, this is just the way it feels, and this is normal, and there's nothing else I can do. And those just simply aren't true for the most part. I see this all the time where patients say, oh, I feel fine. But yet we find some things on labs, or we find things on monitoring and say, let's do this, this, and this. And then they come back in a month or two like, oh my God, I didn't realize how bad I felt. I'm like, yeah, well, you didn't feel that way overnight. You got there over years. Mm-hmm. And when it's so slow and gradual, you just start to accept mentally that this is just the way it is. And it doesn't have to be. I honestly can say at 40, well, real close to 49, I feel better today than I did when I was 35. Have I aged? Yes, I have. But at 35, I wasn't doing anything to help myself with my health. And it was really taking a toll on me. And so a lot of patients are in that same boat, and they just don't know where to start with it. And I think sleep and intermittent fasting are two very easy, cost-effective ways to go after. Get some form of a sleep monitoring device. They're $200 or $300, but they'll last you years. I've had the same Oura Ring forever. $2.99, but it gives me, I literally don't wake up a morning that I don't check it first and see, okay. And it kind of tells me how my day is going to be. I want to know how I slept, and I'm constantly fiddling with things, trying to figure out different ways to sleep better. I haven't got my sleep back completely, but I've got my deep sleep from about 3 minutes up to about 30 to 40 minutes, which is, we'd like an hour, but we're working towards it. And if you're sleep and doing the intermittent fasting and mixing in some, so one of the other questions I get is, okay, so what do I eat between 12 and 8 if that's when I'm going to feed? And, the good news is you'll get success even if you don't change your diet.
Right.
The studies are quite clear that when they did the studies on intermittent fasting, they didn't ask people to change their diets. They just said, I want you to eat between 12 and 8. Eat whatever you eat, but just do it between these 8 hours. And of course, another phenomena happens when you only eat between 12 and 8. You're not going to feel the need to cram in a normal day's eating schedule into 8 hours. So you are going to naturally intake less calories. But it's been shown that even with the studies, though, if you eat the same amount of calories that you normally ate in 24 hours and 8 hours, you still see the benefits of weight loss. And I think that's a really amazing part. You split that food up through the day, you don't get all those benefits of low insulin levels and increased autophagy and increased brain function and athletic performance. And you also get weight gain instead of weight loss whenever you're doing it that way, for a lot of us, or at least not weight loss. So, I think it's always good to follow some form of a high good fat diet with moderate protein. Of course, there might be some situations where we wouldn't do that with a patient, but for the most part, a low carbohydrate, which is 25% carbs per meal for me, is what I try to tell patients. And I don't ever try to tell my patients either to measure things or necessarily read labels. I just try to train on what's good foods and bad foods and how to combine them. And try to stay away from those inflammatory foods. If you don't mind, let's kind of go over a little bit of those inflammatory foods. Hormone, anything that's got a lot of hormones in it, inflammatory. Okay, so we do want to kind of spend that extra money on the hormone-free meats, preferably like even the grass-feds. They do make a difference. Staying away from gluten products the best we can, mainly it's your wheat products, and mainly that's your breads and pastas. Trying to stay away from the really sugary things, especially like sugary fruits, tropical type fruits. I really try to get my patients to stay more with berries and apples, like blackberries, raspberries, blueberries, strawberries, green apples, red apples, really trying to stay with those, stay away from the sugary fruits. Staying away from anything that's got artificial sweeteners in it to the best of our ability. And then I think it's always good too, if a patient will consider doing a food sensitivity testing. They're really easy to do. They can be as simple as a finger prick. Just make sure your provider is using a good quality food sensitivity testing company. Like we use KBMO in our office. And with a food sensitivity testing, you can find out what actually your body, what causes inflammation within your own body. Because we have this thought that the only way we're allergic to something is if it makes our eyes swell shut or makes us stop breathing. And certainly that's an allergy, but that's not the only allergies that we experience. And these companies now can basically take your blood, test it against all the most common foods, and bring back to you what's allergic, what you're allergic to or sensitive to. Like one of my patients this week, it came back, he was highly allergic to eggs. And guess what he has every morning? Eggs. And his wife, one of her allergies was lettuce. And guess what? She takes a lot of salads. And so, it can be a little bit of a costly test. It's about a $350, $400 test for a good, legitimate lab. But that gives you great data, because whenever I see it and I get it back and I see somebody that's been working so hard and has in their eyes been eating so clean, but yet they were freaking sensitive to what they were eating. Mm-hmm. I'm like, oh my God, if we'd have just known that eggs was your nemesis, we could have eliminated that from your diet. Wow. And so the food sensitivity testing is something that I believe is really important as well.
You're listening to Peptides and Age Management with Dr. Kris. We're having a fascinating conversation about fasting. You know, the folks that listen to this, they want to take more control of their health. They want to be proactive. And Dr. Kris has become the voice for those people. And so these conversations are so empowering. So what are some of the supplements and or peptides that we can consider to help our fasting be more effective, to speed it up?
Yeah. So the biggest thing is just I'd really recommend that every patient get with their provider and really discuss their supplements. It's something that I'm really focusing on this year with my patients, is making sure I know everything that my patients put in their mouth that is a supplement or a medication. The amount of money that's spent by patients on supplements at times can be staggering, and they may be not even buying good supplements, quality supplements. And so I just think it's really important that we as providers actually sit down, make sure we understand what they're taking. It's also important for patients to understand about the quality of a supplement. And they have to understand that in America, the FDA does not regulate supplements. Supplements is an unregulated market for the most part. As I always say, as a joke, but it's the truth, Steve and I could start a supplement company and have it out there in a few weeks. And as long as we don't kill people or make crazy claims, we're okay. And they did a study a few years back, and they found actually the majority of supplements not to have, at least not what they claim to be on the label as far as quantity. Some didn't have anything in it that they had on the label. So making sure that you're getting a quality supplement product that you can trust. I only sell, like in my office, pharmaceutical grade supplements. They're independently batch tested. So that's really important. As far as the supplements that I think are really important with fasting, and I don't know if I say with fasting, but I think it's also just important if you're going for wellness. But the vitamin A, D, and K is just so important right now. The vitamin D, as far as our immune system, our bones and joints, the vitamin A for our eyes and overall health, and the vitamin K2 for our heart. That is, for me, the core vitamin that all of us 35-ish or older should be on. And luckily, the company we use, they make ADK all in one capsule. It's very, very easy to do. The thing to remember about vitamin D, though, it's a fat soluble vitamin. What does that mean? Well, it means it should be taken with fat for it to absorb correctly. Because sometimes I'll see my patients taking their vitamin D, but they're taking it fasting. And you can do that, but you may not be absorbing but a small portion of that. So that's one of the educational things I'm really trying to push here lately, is make sure you're taking A, D, and K on with a meal to make sure you're absorbing it correctly. DIM, very, very important supplement with fasting, in my opinion. It's the base compound of broccoli and Brussels sprouts. It does a good job of actually kind of leveling off our own sex hormones. We use it a lot in our practice, especially for blocking hair growth and some other. It's good for the prostate in men, good for the breast health in women. So that's another really good one. But really, when it comes to supplements, the most important thing is just making sure you have a plan that fits the patient. And sometimes labs can really help with that. As far as peptides, there's one peptide that is actually called, the name says it all, deep sleep inducing peptide, DSIP. We're actually not really quite 100% sure how it works. We believe it's through induction of the neurotransmitter GABA, and which helps us get into that deeper sleep. But for some of those patients who just can't get the deep sleep, despite maybe all the things that we've talked about, maybe plus a few other things, DSIP can be a nice peptide to try with your provider for helping induce that deep sleep. It is a peptide when I've used it, it's kind of hit or miss. It's either like a grand slam or it's a strikeout, but it's worth a try. It ain't going to hurt anyone. And then, of course, going back to the workhorse, a growth hormone secretagogue like CJ-CIP or Morellin. Most of my patients, especially when we dose it at bedtime, because we're getting that bump in growth hormone as we sleep, will notice an improvement in deep sleep and an improvement in just overall restorative sleep.
That Dave Asprey, he talks about in your cells, you develop the fat, and it's a bunch of oils. And he talks about good oils as opposed to bad oils, but I'm not clear on what are the good oils that we need to be consuming as opposed to the bad oils.
Yeah, actually, thank you. I should have said that in the inflammatory discussion, and I totally forgot about it. So you want to stay away from the plant-based oils. So your vegetables, your canolas, sunflower oils. You want to stay actually with basically olive oil, and actually making sure that you have a high quality olive oil or even like a avocado oil. And those oils are actually so good for you. And so that's where like those good fats come in, where patients are like, well, oh, and the other inflammatory food that I completely forgot about that I should have mentioned is dairy. So many people are dairy intolerant, and I'm not saying to take dairy out of your diet, but maybe play around with it. Do some dairy and really pay attention to how you feel 2 to 3 hours after that. Do you get a little bit of a stomach ache? Do you get increased gas? Do you maybe get a little bit of loosening of stools? Those are some things to kind of look at, because I think a lot of us just don't realize how sensitive we are. Again, that food sensitivity test would really help, figure that out. But if you're not wanting to spend $350, $400, that's a way to go about it. But the other thing with fasting that I thought is very impressive is some people can even use fasting kind of as a spiritual thing. They just feel more freed from thoughts. They feel more connected to whatever God they relate to. He talks about monks and oh gosh, I forgot the name of the term for it. Anyway, you can really get in, your senses become heightened, is what people say after you have a really extended fast of like 4 to 5 days. And so he talks at length about just how fasting can actually, increase your spiritual side. So, I mean, there's really a multitude of reasons to do fasting. There's not many reasons not to do it. It certainly doesn't cost anything. That's the great news for, in wellness. So many things cost a decent amount of money. This one's a freebie.
Totally. So excellent episode. There's so much more that we could talk about on this fasting topic, and I'm sure we will. But this has been really good, and it's the more we've talked about it, the more I've investigated it, and the easier it's been for me to adopt it, and it does help you feel better. And on top of that, it gives you a little self-esteem, like this little challenge that you confronted, and actually what you thought you would be so hard isn't so hard. It's
also just breaking that bond between food and the person, realizing that we're not as dependent on food as we think we are. So again, I've already said it, but so many patients think they're going to die if they miss a meal or two, and it's just not true. And you won't feel horrible. Once you get through that first few days of fasting, you're going to feel great. I did that 24-hour fast on Friday, and I thought, I've done 21 hours, 22 hours. We just want to see if we could go to 24. Man, I actually got to 25, and I ate because it was time to eat. I really think I could have gone on. So we're actually, my trainer and I, we're going to, we've discussed it. I think he's in on it. We're going to try to do a 36-hour fast in the next week or so. Because there's some studies that show it 36 to about 42 hours of fasting, you get tremendous stem cell turnover, which is good. So there is reasons for doing longer fasts, but just start with the simple 16-8 fast, and I think you'll do great. So before we go, Dr. Kris, tell us about anything special we need to know that's going on at the research clinic. Obviously, your cosmetic department got really busy after the last episode. So what's going on? We're just, we're just out here trying to help patients. It's the first of the year. We're now into mid-February. I think it's a great time for any of those patients during COVID that haven't thought about their health, or they thought about it, but maybe they haven't done something about it. It's a really good time. It's still early enough in the year to make 2021 special for someone, maybe get some of those pounds off that they're trying to get off, or just feel better. I mean, my first goal for every patient is just get them feeling better. Because, like I always say, we'll spend the maintenance and time and money on our vehicles. We understand the concept of, if I don't rotate the tires or change the oil, this car isn't going to, be a good investment for me. But we don't seem to always take that same approach with our bodies. And, I personally want to work as long as I can, as long as I enjoy it. And in order to do that, I have to take care of myself. And taking care of myself isn't as simple as just taking the medicine that the traditional doctor gives us. That's a very reactive medicine, act of medicine. And that's not what we do here. Don't get me wrong. We prescribe medications. We do traditional stuff. I'm never trying to say we don't, but I would much rather get my hands on someone and be able to avoid all those things over the next 10 to 15 years.
Exactly. All right. Well, another excellent episode of Peptides and Age Management with Dr. Kris. Dr. Kris of Wusterhausen of the Research Clinic. And again, these conversations are intended as educational, and you should always consult your physician before changing a medical program. But if there's something that you learned on this program and your physician maybe doesn't know about it, totally suggest that they connect with Dr. Kris. He's more than happy to work with them or consult them on how they maybe should wrap in some of these what do you call it, therapies that are proactive and
just wellness programs.
Wellness programs. So, all right, Dr. Kris, thanks so much, and we'll see you next week.
Stay warm.
All right, and that's a wrap. Thanks for joining the Dr. Kris podcast. If you learned something today and you want to connect and get more information, visit our website, www.DrKris.Life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris podcast.